Good morning, Las Vegas. This is A Healthier Tomorrow. I'm your host, Will Rucker, and I have a fantastic show in store for you today. So call your neighbors, text your friends, let them know A Healthier Tomorrow is on the air. It is American Heart Month. And so joining us from the American Heart Association is Crystal Webb. She is the Communications and Marketing Director, and she's located right here in Las Vegas. Also joining us today is Aminheh Harvey, Health Educator with the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. You are truly in for a treat. So I'll say it again. Text your friends, call your neighbors, let them know A Healthier Tomorrow is on the air. So without further ado, I'd like to welcome our first guest, Aminheh Harvey. Aminheh, thank you so much for joining us on the program this morning.
Good morning. How are you? Thank you for having me.
Yeah, I'm doing well. Thank you for asking. I'm so excited to have you on the show today because it is Heart Health Month. And so February is one of my favorite months. I was actually technically born on the 29th of February, but I'm just a guy that loves love. So this month is my month and the heart is kind of my organ. So.
Well, that's good. We actually have something in common. My birthday is February 21st.
No.
And so it's nice that this is Heart Month. You know, we want people to love their heart just like they love their loved ones.
That's right. So if you don't mind, just introduce yourself to our audience, let them know what you do at the Health District, and then we'll dive into the topic.
My name is Aminheh Harvey, as Will has already mentioned, and I am a health educator with the Southern Nevada Health District's Office of Chronic Disease Prevention and Health Promotion. I coordinate all of our heart and stroke prevention program activities.
Awesome. So you've got a big job.
Yes, it's a fulfilling and it's a rewarding job to have, to be able to engage the community, raise awareness, and help them make healthier lifestyle choices. So it's a very rewarding job.
Yeah, and it's important work. So thank you for what you're doing in your service.
Thank you.
Now, I want to dive into this topic because half of all African Americans have some sort of cardiovascular or heart disease. Why is that, and what can we do to turn those numbers around?
Cardiovascular disease is the leading cause of death. And unfortunately, African Americans are disproportionately impacted by heart disease and stroke. And with this month being American Heart Month, it's really important for people to make some lifestyle changes, take some small steps to make those lifestyle changes. And high blood pressure is a contributing factor. 2 out of every African Americans have high blood pressure. And many don't even know that they have high blood pressure. And those that do, some of them are not treating their blood pressure. They're not managing their blood pressure. And when blood pressure is unmanaged, it can lead to some complications, and that can be heart attack. People can experience a stroke, kidney disease. There's a lot of things that can be happening, and people are unaware of the damage that's happening on the inside of their body. So it's really important to manage their blood pressure, monitor their blood pressure. If they have a primary healthcare provider, I encourage everyone to have a primary healthcare provider. If you have that care provider, getting wellness checks to get your blood pressure checked. We always tell people when we're out in the community, know your numbers. And that means your blood pressure, your blood glucose numbers, and your cholesterol. All of those have an impact on each other.
So high blood pressure is a risk factor for heart disease. Is that what I'm hearing?
Yes.
As well as cholesterol and other factors.
Yes. And if a person has high blood pressure, it can increase their risk for diabetes. And in reverse, diabetes can increase your risk for high blood pressure.
Wow. And I know diabetes is a major issue within our community as well. So are there any ways to address maybe even both?
Yes, we have a lot of information on our website, www.gethealthyclarkcounty.org. And there are a lot of information, a lot of resources that people can gather. And for high blood pressure, making some small changes. You don't have to create this full list of changes that you just want to tackle. I know we're in the new year. We're just in the second month of the year, and people have their New Year's resolutions. and people want to say, hey, I'm going to lose weight. I'm going to change my diet. Sometimes those goals can be drastic. So maybe starting out small, but ways to lower your risk. Not smoking is a risk factor. Eating a healthy diet can help improve your blood pressure as well as your glucose levels. Walking, exercising, increasing your physical activity. And I know that right now with the pandemic, a lot of people may not be getting out because we're on orders to, stay at home. We're on pause orders. So some people are staying at home. They're abiding by those guidelines that the governor has set. But you can do things by just being at home and getting on a virtual fitness class. There's plenty of apps out there for that. If you do want to get outdoors, on our website, we have physical activity link, and people can download apps like Neon to Nature. Those apps have some really good information for people to get out and discover some of the parks and trails that are right in their backyard. I myself have been able to take advantage of some of that. I go to the park with my family. We take a walk just to get outside, but we're also being physically active. And that helps with your heart health to be physically active.
So it sounds like small steps can make a big difference for heart health.
Yes, they can. Yep.
Since people are home more, that means there's the greater potential for them to cook at home more.
Yes.
Is there any difference between eating at home versus getting takeout or fast food as it relates to heart health?
It is, because one of the things you also want to manage while you're eating healthier, adding more fruits and vegetables in your diet, is also managing your sodium level. Taking a look at how much sodium intake you're getting. When you're eating processed foods, when you're eating fast foods, those foods are going to contain more sodium than if
by sodium, we mean, that flavor, that salt. Okay.
Yes. Yes, we're talking about salt. And managing your salt intake is going to have significant outcomes in improving your diet. As Americans, we get a lot of salt intake on a daily basis. The average American gets about 3,400 milligrams of salt. That exceeds what the recommendation is from American Heart Association. The recommended amount is actually 2,300 milligrams of sodium a day, and that's only a teaspoon of salt. So that's still not a lot, but that's the recommended amount of sodium intake that we should have. And that's assuming that you're not at risk for high blood pressure or you have not been diagnosed with high blood pressure by a healthcare professional. If a person has been diagnosed or are at risk for high blood pressure, they should only consume 1,500 milligrams of sodium a day. And that's less than a half a teaspoon, really less than a fourth of a teaspoon of salt.
So really, people shouldn't be adding salt to their foods at all, finding other ways to flavor with maybe onion and garlic or natural spices.
Yes. Flavoring with lemon is a good substitute for salt. It still gives you kind of that salty flavor. It may be even some dry herbs, adding some thyme or adding some basil. Playing around in the kitchen. I know during the beginning of the pandemic, we were playing around in the kitchen. We were looking up recipes and making cooking fun. And you don't have to add all of that sodium into your foods. And it can still be flavorful, even if you just add dried herbs or salt substitutes into your food when you're cooking. And you're still
Aminheh, you've got me over here. My tummy is rumbling. My mouth is watering, thinking about food and being creative with this. So thank you for sharing those tips. Earlier, you mentioned that smoking is a risk factor for heart disease. I know a lot of us make the connection to our lungs and know that it's bad for our lungs, but how does it affect the heart?
It can affect the heart by causing the heart to overwork, and it can cause that damage to the heart. But if a person were to stop smoking, that damage to the lungs can be restored. Mm-hmm.
Okay, well, that's good to know that there's a recovery from it. But that's fascinating, that connection with making the heart work harder. And I guess all of this really ties together because we eat when we're stressed. We, maybe want to smoke when we're stressed and that sort of thing. And really the best thing that we should be doing is physical activity, taking a walk or meditation or something like that, just reading a book, listening to some good music, other ways to deal with stress. Does stress also impact the heart?
Yes, I'm glad you mentioned that because I was going to say that. And I know that during these unprecedented times, that a lot of people are feeling overwhelmed, they're feeling stressed out, and stress is a risk factor for high blood pressure.
So, Aminheh, we're talking about blood pressure and the importance of knowing what your numbers are. But once you know the numbers, how do you know that they're normal?
A normal blood pressure is less than 120 over less than 80. That is
Say
a
that one more
normal.
time.
Less than 120 over 80
Okay.
is a normal blood pressure range. High blood pressure is considered 130 over 80. That is considered stage 1 high blood pressure, and one greater than 140 over 90, that is stage 2. So it's important. We want to have our blood pressure less than 120 over 80.
That makes sense. So we want to make sure we keep our numbers in the healthy range
Yes.
and basically just manage ourselves, right?
Right. Just manage your blood pressure. Yes. Just to backtrack, you mentioned about smoking. If there is anyone that is interested in stopping smoking, I know that that's sometimes a habit that can be a challenge and difficult to break. There are resources available. If you call from a Nevada number, you can call 1-800 quit now. There are customized interventions that are tailored to your needs, and they can call 1-800 quit now.
All
That's the
right. And it's
Nevada.
free for that?
Yes, that's the Nevada Tobacco Quit line.
Okay. So you've given us some ABCs of heart health, is really what's happened today.
Yes, yes.
Now, I know this isn't happening right now because of COVID-19, but you've had some great success bringing health to the community through barbershop and other outreach venues. Can you share more about that?
Yes. We developed a barbershop health outreach project. That project has been going on for a couple of years. And the reason our goal really was to address hypertension in the Black community. Initially, it started out as a focus with our priority group males, because males are they're not going to the doctor, they're not engaged in primary preventive care like women are. We really wanted to encourage them and empower them to adopt healthier lifestyles and really take better care of their heart health.
Yeah, I mean, let's talk about that because brothers got to get it right. We're the backbone of the community and we need to take care of ourselves. I know that we don't like going to the doctor. Sometimes I know, at least for me, I don't even want to know what's happening. I just figure it'll go away eventually. It's so important that we know our numbers, that we know what's going on, because early intervention is key to saving lives. Thank you. Just wanted to do that quick commercial break. Go right ahead.
Yes, it's very important. And what better place to have this intervention and to offer it in the community by choosing the barbershop? It's the hub of the community. It's the gathering place. Men are there. They're having conversations about various topics, politics. They're talking about sports. They're indirectly talking about health, because if something happens to a friend or a customer, or maybe even something that has happened to them, they're usually sharing it with their barber. And so why not integrate healthcare into that conversation? And we've taken a non-traditional approach to meet them where they are and have these conversations in a place where they trust, a place that they feel comfortable, and their barber has that influence to encourage them to manage their blood pressure. Barbers will encourage them by modeling and getting their own blood pressure checked. So we're bringing this resource to the community, and what we do is we have volunteers. They're trained volunteers. Some of them are nurses, and some of them are non-medical professionals, but they have the training to measure blood pressure accurately. They provide them with heart health information, give them tips and resources on how to improve their blood pressure. We also provide them with resources if they don't have a medical care. So if there's anyone who says, I don't have a primary care provider, I don't have insurance, then we refer them. We have a primary referral source that we use. We also give them a full list of places that they can go in the community if they don't have insurance, or we can direct them right back to their own primary care provider. And
That's
we've been
awesome.
able to see some success with this project. Initially, we started out with three barbershops. All of these are Black-owned barbershops. And we have now been able to expand our project, and we have 8 barbershops. I'm actually in the process of recruiting one more barbershop to add. We want to make sure that this resource is available to as many barbershops in our community as possible. My ultimate goal is to be able to see this offered in all of our barbershops here in our community. And we were able to also expand to the beauty salons. So we don't want to leave the women out, because we realize that our community as a whole, men and women, we both need these resources. We both need that extra push and encouragement to take better care of ourselves.
That's so true. So I'm glad that it's now expanded to both the barbershop and beauty salons. So when this program starts again, after this pandemic is over, which hopefully everyone is getting their vaccines and getting, taking care of themselves in that way. But we'll have to have you back on to A Healthier Tomorrow once this is back up and running, so you can share what shops we can go to and a little more information on that.
So I do want to give a quick shout out to all of my barbershop partners for our Barbershop Health Outreach Project and Beauty Salon Health Outreach Project. If anyone is interested, once we are able to resume, we're hoping to resume sometime in the spring, but you can always check our www.gethealthyclarkcounty.org website. We will continue to have updates available on our calendar. I do want to add one more thing, because I know that because we are in a pandemic, I don't think that people are going to the doctor, or if they need medical attention, they're probably a little bit afraid. But I want people to know that timing is everything. And if you are experiencing any type of symptoms such as a heart attack, if you're having chest pain, pressure in your chest, shortness of breath, if you're having cold sweats or dizziness, any type of symptom that you're having, please call 911. Timing is everything, and our healthcare providers, they're taking all precautions to make sure that people are safe from being infected with COVID. And please just take care of yourself and continue to go to the doctor.
That's so important. I'm so glad you brought that up. Still get yourself checked out if you're having symptoms, anything like that. Please go to the doctor, call 911 if it's an emergency. Even in the midst of this pandemic, other issues still happen. Life still happens. So we got to take care of ourselves.
Yeah.
We thank you for your partnership with the Healthier Tomorrow radio program, because without your support, we couldn't get this information to the community. So thank you for your time this morning and for the wealth of information that you shared. And like I said, once your programs are back actually happening, we'll have you back on the show to share more about them.
Yes, if anybody wants additional information or would like to contact me about the Barbershop Health Outreach Project or the Beauty Salon Health Outreach Project, they can visit www.gethealthyclarkcounty.org to learn more information. And I will repeat it one more time. That's www.gethealthyclarkcounty.org. Perfect.
Thank you so much, Aminheh. Have a great rest of your morning.
Thank you. You too.
The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Heart disease is the #1 killer of all Americans. The risk is higher for African Americans. African Americans are 20% more likely to die from heart disease than non-Hispanic whites. For more information on heart disease and how it can be prevented, visit www.gethealthyclarkcounty.org. And with that, I would like to welcome Crystal Webb to A Healthier Tomorrow. Good morning, Crystal.
Good morning. How are you?
I'm doing well. How about yourself?
Pretty good. Can't complain.
Good. So glad you could join with it being Heart Month. That's perfect for you to be here for this.
Absolutely. Yeah, we're really excited over at the American Heart Association. So February is designated as American Heart Month. And what that means, it's just a really great time to remind ourselves about how to raise awareness about heart disease, because it is the #1 killer globally. Even this year with COVID, it still ranks up top. And so it's just a really important time to raise awareness about how prevalent this really is.
Yeah, it's a serious issue, particularly in the African American community. So that stat you just shared, though, is startling. I would think that COVID would have overtaken it, but you're saying heart disease is still ranking very high?
It is, yeah. So globally, it is. We just had the recent statistics come out, and it is globally still the number one killer, cardiovascular disease. And so those rankings might change and shift a little bit when you look at US and as the years go on. But for right now, it's still, yeah, heart disease, unfortunately, tops that list.
Wow. So it's really important that we do what we can to protect this vital organ.
Absolutely.
Yeah. So
absolutely.
could you share a little bit about what the American Heart Association is doing in regards to COVID-19?
Right. So we are doing a lot on a lot of different fronts to fight the pandemic. And so as soon as it's happened back in March, our organization mobilized to see how can we really fight this pandemic because we are in so many different areas of health. Are we going to be most effective? So first and foremost is scientific research. That is what really drives us. That's what really drives our passion, and our volunteers' passion is funding medical research to find cures and treatments for heart disease. So things like historically CPR, pacemakers, all of that kind of stuff, that life-saving things that we just take for granted today, those started with American Heart Association research. So
Wow.
with the pandemic, we're really targeting our dollars into research projects that really focus on trying to find that scientific, that medical connection between what coronavirus is doing to your heart. Because we all watch a lot of news, and we know anecdotally a lot of patients are suffering from heart and lung damage. But to figure out what is that specifically, scientifically, that's what we're really trying to get to the bottom of. So hopefully in the years to come, as we treat COVID patients, we can create treatments that can really, really help them.
That's going to be so important. And I know so many people, the former host of this show actually was lost due to COVID. So it's still hard to even think about.
Tragic.
Yeah, it's really impacting on our community. So with that, I want to turn to something a little bit lighter. And that is the fact that this month, you all are doing some really special things, and that is going red. So could you tell us more about that?
Absolutely. So obviously, American Heart Association Red, they go hand in hand. And we just celebrated National Wear Red Day on Friday, February 5th. So that's when we asked everybody to wear red and share a pic with us about showing how they did that in order to raise awareness for heart disease. But the wonderful thing is that February is all month long, and we want to see your pictures all month long. So we're really encouraging everybody in Southern Nevada to if they're wearing red, take a pic and share it with us online with the hashtag LVGoRed. And what we're going to do with photos is we're going to compile it all into a beautiful montage showing just the whole entire community and the strip and really a lot of landmarks throughout Las Vegas going red and showing support for HA. And we're going to showcase that on social media. So if you want to be part of that, make sure you get your picture in. But also in next month at our Go Red for Women luncheon, which will be digital for the safety of our guests. But we'll also be showing and featuring pics from the things that we get throughout February at our March 25th event.
That's so exciting. So March 25th, big event happening. How do people connect with you for that?
So they can go online. So this is going to be a digital event, so it's going to be free and open to the public. You just have to register in advance to be part of the Zoom webinar. You can go online. Our registration isn't quite set up quite yet, but once you, in just the next few weeks, if you just Google Las Vegas, Go Red for Women luncheon, that'll lead you to our website with the registration link, and that should be set up within the next few weeks.
Awesome. Well, yeah. Free is my favorite price tag. So
yeah, mine too.
Great. So Crystal, I want to just talk a little bit about what got you involved with the American Heart Association. What drew you to this work?
So I actually have a personal connection to heart disease, several in fact. And I think if you talk to a lot of people, have a connection to heart disease and stroke, which is also part of cardiovascular disease. And so my personal connection is my mother. So she was diagnosed with type 1 diabetes back in the 1970s, and she's been managing great ever since. But because of that, there's a connection between diabetes and cardiovascular disease. And sure enough, a few years ago, she suffered her first heart attack. She survived, and she was able to get to the hospital. However, one of the things we talk about at HA is as soon as you're suspecting something might be going wrong, or that something is just a little off or different, that you call for help right away. And she didn't do that. She sat around for a few hours thinking, oh, I'm fine. I'm just tired. I'm just a little achy. It's not a big deal. I'll just, sleep it off. I'll just rest a little bit. Turns out she was in the midst of a heart attack. So that's one thing that we really, really urge people to, especially women, to get checked out, because for us as women, heart attacks present quite differently than men. In movies and TV, you see they're clutching their chest and it's like an elephant sitting on there. But for women, it can be just a little bit of pain in your shoulder area and your jaw. It can be maybe a little indigestion and nausea. Or you feel a little faint. And if some of those things are all happening together and it's unusual, that's a good sign just to call and get some help, just to check it out, because, what can it hurt?
And then to get checked and not needed than
exactly
to and not check it out.
Exactly. And any doctor and any nurse is absolutely going to tell you the same thing. They would absolutely want you to get checked out and say, nope, you're okay right now, versus you waiting too late and too long.
Thank you for sharing that. And you've mentioned some of the symptoms for women. What are the symptoms for men?
So men, they get more of the classic heart attack symptoms that you see displayed on movies and TV. So they might get that crushing pressure all of a sudden in their chest that feels like an elephant sitting on it. They might get really sweaty and nauseous, but it's really that crushing chest pain that is the big obvious signifier. But we've noticed in our research that actually happens more in men versus women. So that's why we really try to get the word out about women and the different signs and symptoms of heart attack in them.
Wow, I didn't realize there were such a big difference between how it presents to a woman versus a man. Because you do see the TV, and one of my favorite characters is Fred Sanford from Sanford and Son. I know it's way old school, but he had a heart attack every show. So, we know how that looks.
Right, exactly.
Well, Crystal, is there anything else you just want to make sure our audience knows or is aware of before we close in our last moment?
Yeah, I would just urge everybody watching to, if you haven't gotten checked out by your doctor in a while, and I know it's hard with the pandemic, if you're worried about going into a clinic or a hospital just to get a regular checkup, that's completely understandable. But I would urge you just to get checked out for an annual screening right about now, just to check your cholesterol, your blood pressure, your blood sugar levels. Those kind of things are something, if you catch really early on, you can really reduce your risk for heart attacks or cardiac arrest. For me personally, I'll just say that last March, I went to get my annual checkup and I did have high blood pressure, but now I'm managing it with just a simple pill a day, and I feel great. And I'm in my mid-30s, so it would be really, sad if that hadn't been caught earlier and something even worse had happened. So I'm really appreciative that I got my blood pressure checked.
And that's good advice. Always get your numbers checked. Crystal, thank you for joining A Healthier Tomorrow, and you'll have to come back and tell us how the event turned out.
Absolutely.
Thanks so much. Have a great rest of your day.
You too.
The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. During the early months of the COVID-19 pandemic, emergency department visits for heart attacks and strokes decreased more than 20%. If you or someone you know is experiencing a heart attack or stroke, please seek medical care immediately. For more information on signs and symptoms of heart disease, as well as how to prevent it, visit www.gethealthyclarkcounty.org. This has been A Healthier Tomorrow. I'm your host, Will Rucker, and I want to thank you for tuning in today. I want to remind you that you are not just a drop in the ocean, but you are the entire ocean in a drop. So live purposefully so that we all can experience a healthier tomorrow. Again, guard your heart, because out of the heart comes everything else. It's been a privilege, an honor, and a pleasure to be with you this morning. We will see you the same time on the same station next month.